for there to be a collaborative process. And this is something that we have seen in Fortis Healthcare, where we have been running a consultation liaison program for the last decade that we have been here, where we have therapists, psychologists, counseling psychologists who are working with the inpatients every day. We have our therapists who work with the inpatients every day. We've got people providing sessions within the OPD as well. We ensure that there is psychology which is integrated into the preventive packages as well, so that there is a whole rounded support which is being provided to every patient who is stepping into the healthcare system. That any individual where we can see that there would be a facilitation of the treatment process and the right kind of support could ensure that they are complying with the treatment, their recovery is better, they're being able to take care of the steps that they need to, and they're bringing about the right lifestyle changes that they need to in order to make sure that they end up doing well in the long run, are taken care of. And these are tested practices which are being utilized the world over. And I think more than anything, especially in a large country like ours, it's so important for us to keep talking about aspects of mental health, particularly within tertiary care centers, particularly within mainstream healthcare, because that's how you keep beating the stigma. There is no doubt that mental health still has immense stigma that surrounds it. People hesitate to talk about what are the challenges that they're experiencing, where are the difficulties that they may have, whether it is with their own individual's health, whether it is within a certain family, with a certain family member, or they have larger issues within the context of their workspace or their extended families. We hesitate to talk about the problems. And if we make mental health, we make psychology, we make therapy, consultation liaison as commonly approached aspects within healthcare, we're able to ensure that we can keep busting these myths, this stigma that keeps surrounding mental health, which prevents people from being able to take care of their own selves. And which is where I think the pandemic has been really insightful, because what it has done is it has created a lot of conversations around how the provision of mental health could facilitate better recovery for a lot of people who were even diagnosed, who had COVID, who were struggling to recover because of the kind of isolation that they had to experience, the kind of loneliness they experienced when they were being quarantined. And people did not have options here. And you all know that for a fact, working in the medical healthcare space, you were all aware of the kind of challenges that people have faced during this time period. And mental health in that context became a very, very important element that has been crucial to the recovery process as well, allowing people to be able to keep taking the steps that they need to in order to move forward in their lives, and also cope with the many significant losses that they have, especially in the second wave. The number of people who benefited from grief and bereavement counseling, who have benefited from being able to talk to therapists, to be able to share their experiences of what it was like going through the entire quarantine period, has really benefited a large number of people. And I I do understand that a lot of times it may not be possible that you have an in-house counselor who's available, but that is where I think we all need to be innovative, and we need to come up with varying ways in which we can still provide much needed mental health support to patients. And one of the easier ways to do that is to keep making sure that the helplines that are available within the country, and there are numerous helplines which are available, some which are available during the day, some which are available 24/7, some which are available in multiple languages. We at Fortis ourselves run a 24-hour helpline, which is run in 14 national languages. We need to provide patients with that information so that even if they do not have the availability of a mental health expert in person, at least they have recourse to reaching out to someone in order to be able to take care of their mental well-being. And this is something which is important for every individual, because the stress of going through a physical health related concern can be immense, even the financial burden of it. The fact is that we still do not have 100% insurance coverage for all patients who come into healthcare. The financial burden of that can be immense. That creates its own pressure on people. both the patient and their family members. So even mediating those kind of conversations becomes very essential. So, all in all, there is no substitute for mental health and the mainstreaming of mental health, of psychotherapy, of psychology within healthcare. And each and every individual, all of us, are going to play very crucial roles in being able to enhance and ensure that this is something which does happen over a period of time. And I believe truly that for every individual who's here attending the webinar today, it is each of our responsibility to ensure that we are going to go back and have these conversations to say that, yes, this is something which is crucial, which needs to be integrated. And if we know of people who require that kind of help and support, we are going to also push them to seek much needed help, because it's okay to seek help. And that has to be the norm. That has to be the way forward in order to ensure that we're being able to provide holistic um, healthcare services to all the people who walk into any of the healthcare systems that we have available around us. So this is something that I truly believe, and we truly believe, our entire department at Fortis believes, that mainstreaming of psychotherapy is going to be very crucial in the long run, and it's going to play a very large role in taking care of the large population that we do have over a period of time, and to ensure that there are better health outcomes for people who do get admitted for diverse health related concerns as well. So